Welcome to the Accidental Experts podcast. I'm your host, Bryce Hamilton. I'm a licensed clinical social worker and a child and family therapist. I have been in practice for over 15 years, and I'm also a mom of 4. So I know the challenges both professionally and personally. I'm so glad that you're here today to grow your parenting toolbox. Please come as you are and be ready to learn. My goal is to make you the accidental expert so that you can raise healthy humans. Hi, everyone. Welcome back. I'm so glad you're with us today. So, we are going to be talking about OCD, obsessive compulsive disorder. I don't know if you know much about this, but I think there's a lot of misconceptions around what OCD looks like and how to diagnose it. So, we have a special OCD expert. Her name is Erin Davis, and she is a practicing therapist who primarily provides services to people with OCD. So, we're going to get to know OCD and what we should be looking for. With that, let's get to Erin.
Thank you, Bryce, for having me. It's such a pleasure to be here, and I'm so glad to be chatting with you.
Yes. Okay. So we're going to be talking about this topic that is near and dear to my heart because OCD has shown up so much in my professional life, but also in my personal life. So I'm glad that you're here to kind of help us to understand what OCD is and what we can be looking for in both adults, right, and children that can have OCD. So can you start with
Yes.
talking about what OCD is, what it looks like, and how it's different than maybe how we perceive it, like what the misconceptions of OCD look like?
Yes, absolutely. Well, in OCD, it gets missed more than 50% of the time with patients. And it can be very sneaky and tricky because it's not just about hand washing or cleaning or organizing. And a lot of times that's all people think it is. And they'll say,
Mhm.
"Oh, I'm so OCD." And it's like, if you really had it, I mean, the signs start with an intrusive thought, feeling, urge, or image. So,
Mhm.
with it being intrusive, it means that it's unwanted and involuntary.
Mhm.
And truth of the matter is, we all experience intrusive thoughts. At
Mhm.
some point in our life, we've had an unwanted thought, feeling, urge, or image, and it can play out like a movie, and it all depends on the person. But what happens with someone who has OCD is that thought gets stuck and it plays on repeat. And that's how children most often identify the OCD. It's that these thoughts are very distressing and they can't get it out of their head. And
Mhm.
so what they then do, it's a part of the cycle. They'll do a behavior, which we call a compulsion, and that is to help get that thought unstuck or to
Mhm.
prevent that feared thing from happening. So,
Mhm.
all in all, it's a cycle. And the biggest thing I want the listeners to remember is that OCD is a shapeshifter. So, even if you've got a fear of, let's say, knives today, maybe when your child is going through puberty, their fear is going to be about relationships or
Mhm.
friends. So, it, especially in kids, it shifts a lot depending upon their developmental stage.
Yeah. So it can look like one thing and then morph into something else. And it's not really something new. It's just OCD presenting in a new way.
Yes, exactly. And the good news is the techniques can apply to any of the themes that the children are dealing with, or even if it's the parent. These techniques are very effective and can help at any stage.
Yeah. So let's back up and define what OCD is. What do the letters actually stand for?
Oh, yes, good question. So it stands for obsessive compulsive disorder. And with OCD, it's so common that 1 in 40 adults will develop OCD at some point in their life. Now, it can go into remission if you know the techniques or can manage your way through the thoughts.
Mhm.
But with that 1 in 40 people, that is approximately 8.2 million adults, which is close to the same number of people living in New York City.
That is a lot of people.
It
I think
is.
we don't recognize it. So there must be signs and symptoms that we are missing that
Mhm.
we could identify or should identify as OCD, but we call it something else, or we're like, oh, I'm just type A, or I'm, like I'm just particular about this, or this is just like one thing that bothers me. But sometimes it's way more than that. Sometimes it is just
Absolutely.
that small, like it is just a small deal. But I think there is also, when we're looking at OCD, a factor of like it has to take up significant amount of time, right? It
Yes.
can't
Good
just
point.
be something where it's like, oh, I obsessively clean before people come over, right? Like I'm
Mhm.
so like OCD about this thing, but it has to take up a significant amount of your time with either the thought or the reaction to that, like our
Good
obsession, the
point.
thing we're thinking, and then our compulsion, what we do to kind of alleviate symptoms.
Yes, exactly. So therapeutically, it has to take up more than an hour of your day and also interfere with your life.
Yeah.
So, if part of your job is being a janitor, like we're not going to hold that against you that you're cleaning things for 8 hours a day. So, but if you're doing this constantly, and like with kids, a lot of times they'll have the fear of throwing up,
Mhm.
and that's its own challenge, and it has its term called emetophobia. And I treat a lot of young girls with emetophobia. And what they do is they will continually wash their hands until it's cracked and bleeding. So, and then it's embarrassing for them. So it
Mhm.
very much interferes with their life. And yeah, it can be a long road. And what tends to happen with all these patients, they come to me saying that they have a lot of anxiety. And I put that in
Yes.
air quotes because that's what a lot of providers will say, like, oh, this is just anxiety. But the difference is the level of distress and the interference it has in your life and the problems it creates.
Mhm.
Because, of course, it's reasonable to wash your hands if you're afraid of throwing up, but it's not so reasonable if you're washing your hands 20 times a day and they're bleeding.
Mhm. Yeah,
So it's
there
next
has some
level.
type of consistency to it, right? So it's like sometimes it's about like how hot the water is, how long you're doing it, how many pumps of soap, right? There can be lots
Yes.
of different nuances to things. And then it can be some things that are totally different than washing hands. So, can you tell us what are
Mhm.
the most common signs and symptoms that we're looking for in terms of OCD and how someone can recognize if they or somebody they love might have OCD?
Okay. Well, a lot of the times, the person with OCD is going through a silent struggle because they're very much in their head and they're obsessing and worrying about the fear. So, from a parent's perspective, what they may notice is that their kid does seem to be in their own world a lot of the time. Now, one of the more observable things besides the hand washing will be their reassurance seeking.
Mhm.
Meaning they are asking their mom and dad like over and over, are you sure I'm not going to get sick? Are you sure
Mhm.
I'm not going to get the stomach bug? Are you sure I'm going to be okay? So it's like, and you want to say, honey, I've already answered this 10 times. So
Mhm.
when they continue to ask the same question over and over and over, that's just the OCD in the kid's brain saying, yes, but. And it's
Mhm.
always trying to find a loophole.
Yes.
So those are some of the key signs that really the reassurance seeking comes up so much for the
Mhm.
parent child dynamic.
Yeah. Well, and one of the ones that I see a lot in my office that, because in fairness, I think OCD has really grown in terms of what we understand about it. I think mental
Hmm.
health just in general has since I finished school. So a lot of the learning I'm doing
Yes.
is independent from my schooling education. And so when I finished school, there wasn't these different types of OCD. So they're not like
Hmm.
us, like we're not actually necessarily diagnosing somebody with a subtype of OCD, but it helps us to
Correct.
identify what it
Right.
looks like. And so the confession of like that's one that I see a lot with kids is
True.
they have to come home or they tell their parent everything they did and worrying that they did something bad or that they're
Hmm.
bad. And it's kind of like if you think of like a priest and the person who attends that church and like telling the priest all the things, but they have to do it is this compulsion that like they feel like they cannot hold on to this information. They must tell somebody this thing that they did,
Yes.
even if it's not bad, but they're just worried it could be.
Oh, 100%. And those are the urges that come up
Mhm.
from the obsession. And I've had many conversation with kids about like, you don't have to overshare.
Mhm.
You're entitled to have your privacy. And so that's just one of the things they learn too. And with the scrupulosity, like you're mentioning, I mean, religious OCD is a very big thing. So,
Hmm.
thinking of the subtypes, I mean, besides the fear of throwing up, there's the germophobia, then there's the religious OCD. I'm also focusing a lot on relationship OCD, but then as kids get older, sexual orientation OCD. I mean, it can show up in almost every area of your life.
Yes. Yeah, and I think, something else that people don't think about as OCD is sometimes this idea of like they might think a thought about somebody else that they would never do. For instance, like
Mhm.
they are like, what if I touched a kid inappropriately? Right?
Oh,
And it was
yes.
just a thought, right? Not something they would actually do, but then they start obsessing over it because they know also socially not acceptable. And then they
Right.
feel like they've done something bad. And so they're trying to get that thought out of their head, right? And so then they're like, even though maybe they love kids, would never hurt them, have no ill intent, would keep themselves from being a preschool teacher or a teacher or helping kids in any capacity because they're so afraid that they might do something because they had that intrusive thought.
Exactly. So that's the pedophilic OCD, and it
Mhm.
also reminds me of the harm OCD, because either way, they are terrified of hurting someone else. And at
Mm.
the core of it, OCD attacks the things you love and value. So if
Yes.
you're experiencing these intrusive thoughts around those issues, even though it seems counterintuitive, because of the distress it's bringing you, that's actually telling us that you love kids or you appreciate human life and that you are a good person. And
Mhm.
OCD will try over and over again to trick you into believing that you're a bad person.
Yeah.
So,
Which is, yes, that totally stinks, right? Like to
yeah.
have anxiety definitely stinks, but then OCD is kind of like a type of anxiety because you do have those distress feelings in your body, and it's just a different way that anxiety is presenting. Is that correct?
Yes, and on because, with anxiety, it's that uncontrollable worry. But
Hmm.
then with the OCD, you've got that uncontrollable worry plus the thoughts popping in at a higher frequency and more
Hmm.
intensity, then you feel like you need to do something about it.
Yeah.
And kind of like what you were talking about earlier, like the sequence in which people might wash their hands, for example, it's like OCD can never get enough. It's almost like an
Hmm.
addiction. No matter
Yeah.
what you do, you can never satisfy it. So
Hmm.
that's why you need to get into treatment with especially with someone who's trained in OCD so that you can get proper techniques to
Hmm.
help you in turning down the volume on
Yeah.
these thoughts.
Yeah. Well, which is it's so hard because people think that this is just how life has to be sometimes. Like, this is just the way I am. And if they are aware of a family history of this, they're like, oh, my mom was like this, or my dad was like this, or my grandparents. So it's just the way we are. But I think,
Yes.
thankfully, we have so much that we know now that we can do things to help manage these symptoms that present, which is amazing because sticking with OCD and just kind of like gritting through is miserable.
Yes. And, now that you mention that, so many people will feel like OCD is a part of them. Like
Mhm.
somehow this is their personality, which is also really sad because if OCD is trying to find evidence that you're a bad person, like, oh my goodness, that's a hard way to live.
Mhm.
And until the person really steps into their own value of their self worth and recognizing that things can be different, like they really have to own that and acknowledge, like, no, that's the OCD voice. That's
Mhm.
not the real me. And
Mhm.
so treatment can help them get to know the real them.
Yes. Which would be amazing, especially as an adult if you've lived with that for a long time. So
Mhm.
that kind of leads me to this question of what are your thoughts around OCD? Is it environmental? Is it genetic? A combination of both? Like, how does OCD happen?
That's a great question because the research is mixed, so it's not a clear indication of nature versus nurture.
Mhm.
But in my experience and in my opinion, it's a lot to do with the environment. because maybe you're having some anxiety or you feel insecure, you don't know what to do. And so you inadvertently find relief in, say, doing the hand washing, or
Mhm.
just even scrolling on your phone can be a compulsion
Mhm.
because you're trying to distract yourself and avoid this intrusive thought.
Yeah.
So we all try to find ways to cope, but there's healthy ways of coping and ways that can be a lot more logical. But in any case, with these thoughts, there is a way through, and the compulsions, they're an easy way to, or short term relief, but it's not going to give you long term
Mhm.
relief because the OCD is going to keep coming back with more questions and more loopholes.
Mhm. Yeah, it always wants more, right? You think
Yeah,
about I talk to kids about, like, the kid in the store who's, like, screaming for something they want, and if the parent gives in to that, right, like, gives them what they want, then the kid learns that if they just scream enough, they'll get the thing they want. OCD exactly the same, right?
agreed.
If you do the thing it wants you to do, then it's like, "Okay, just push harder." So then
Mhm.
kind of unwiring that part or finding ways to not um, appease the anxiety, right? This OCD, then that helps you to become more strong than the OCD is.
Yes, yes, because ultimately what you're doing and what you work on in treatment is teaching your brain that you can tolerate the discomfort,
Mhm.
and you are essentially expanding your comfort zone. So even
Yes.
when you feel the urge to wash your hands or maybe to avoid watching something on TV that would normally trigger you, if you can sit through that, you'll then realize that eventually, oh, like this feeling goes away. It starts to
Mhm.
dissipate, and I didn't have to do anything. So that's again how the cycle can start to break because you're no longer feeding the OCD monster.
Yeah. Which is so hard, and at first it's so uncomfortable, right? So often
Yes.
in care, we're that's why it's also important to have somebody who is knowledgeable is because we're breaking things down, right? Obviously, it's still
Yes.
gonna be uncomfortable, but we're not gonna ask you to do the most uncomfortable thing first. We're building that, we're understanding about OCD and kind of the tricks that it plays on us,
Mhm.
which I think are hard because they're so believable. I mean, because it has access to your brain, right? So it knows the
Mhm.
things that are going to really tip the scales. And so it is a personal attack on us to have this OCD that is like so personalized. If it was like external outside of us, it would be easier to be like,
Yeah.
whatever, like, I don't believe that, but it knows like your intimate thoughts because it's part of what has happened in your brain. And so it knows how to kind of like uproot those things, which can be so incredibly frustrating. So
Mhm.
what is the care? What do you think is the best treatments? Like, can you talk to us about like what the gold standard is, but then also like what kind of things you're doing in therapy to help combat OCD?
Sure. Yeah, the gold standard treatment is exposure response prevention. So as you were saying, when someone gets into treatment and they're with an OCD specialist, that exposure response prevention, we're starting small. We build a hierarchy or a ladder. And the
Mhm.
way I like to think about it is like if you were to go to a workout gym, to a fitness facility, you probably know like some of these machines do certain things, and maybe you'll do the machines, maybe not. But if you had a personal trainer there with you, you're going to start small. You're going to work your way up to these harder or more complex workouts, and you're going to do it safely, right? So that's how an OCD specialist can help you in that journey, because we're going to help you navigate this safely so that you can be successful. Now, if exposure response prevention feels like too much, I always remind my patients that I'll never ask you to do anything I wouldn't do myself or that I wouldn't ask a loved one to do. So
Mhm.
it's all very safe. And there again, that's why you have to have a trained person. And it can be very creative depending upon what your trigger is and
Mhm.
what your fears are. If for some reason the exposure response prevention is not a fit for you, which I'll say it's effective in 80% of OCD patients, so it's very well like the standard.
Mhm.
But if for some reason it's not working for you, there's this other technique called inference-based cognitive behavioral therapy. And a lot of patients find relief in that as well because it helps you. It's a lot of reminders about mindfulness,
Mhm.
essentially, about being in the here and now, being in the moment, looking for evidence, and essentially proving the OCD wrong and bringing yourself out of the OCD bubble and taking that bridge back over to the here and now in reality. So it's a lot of like story based stuff, which people enjoy that too.
Mhm.
So either way, and I've used both, and just depending on the person, both are very effective.
Yeah. I love that we have choices. I love that we know so much about OCD. So a
Mhm.
question that I sometimes get from families too is like, does OCD like just show up and then that's the level that it's at, or can it grow over time or become more intense? And then also, when does OCD typically start to develop? Is there a timeline or a time that we could think like, could our 4-year-old have OCD? Could they not yet? Because, we see that it's evidence that like not until 10. What do we know in terms of that?
Right. Well, so many like interesting parts with this question because OCD, in my experience, can show up at any age. And it's important that you know how to not feed into the cycle once it starts.
Mhm.
Now, on average, it seems that OCD is diagnosed in the like high school years, maybe young adulthood, like college age years, but that's mostly because this person has been dealing with that anxiety for so
Mhm.
many years and hasn't gotten any resolution. And that's again the difference between seeing a traditional talk therapist for anxiety versus an OCD specialist
Mhm.
because the talk therapist is not going to do that exposure response prevention
Mhm.
necessarily.
Yeah.
So yeah, a lot of the times OCD gets diagnosed in those adolescent years, but it can show up in the younger years. I mean, a lot of the patients that I treat in adulthood, they finally made it to treatment, but they've known they had it since like 7, because they can
Mhm.
remember a vivid time, and they keep thinking that it'll get better. It'll get
Mhm.
better. But
Mhm.
the truth is, it will only gain momentum. And the interesting thing about the brain, a lot of this fight or flight response comes from the amygdala, and the amygdala is actually bigger in people who have anxiety and OCD, but through treatment, the amygdala can get smaller, which is
Amazing.
incredible. I know
Yes.
the brain is so fascinating. So once people, and like I'll do a whole like brain diagram with my patients, and once they understand that the brain can change, they're like, wow. Like
Mhm.
it gives them a sense of hope, and it's so exciting. And
Yes.
the amygdala, it's do you know how big the amygdala is?
Well, size of an almond, right?
Yes,
Yes. Yeah.
yes. So for them to have all of this panic and anxiety and worry, once they learn that it's only the size of an almond, they're like, "You gotta be kidding me."
Mhm. Yeah.
Yeah.
Yeah. And it's amazing. I mean, because I think also something that we forget in those moments or we don't ever know is that when you have like any emotion, it's just literally a chemical burst, right? Like it's just
Yeah.
chemicals in the brain, right?
Mhm.
And it lasts for about 90 seconds if we do nothing with it, right? So if we
Yeah.
don't react to that, now that's not saying that we don't need to do something, but in terms of reacting to the emotion, right, there might be things we need to do. And then that's important because if you have a tiger that shows up, the amygdala is our alarm system. It's so
Mhm.
important for our brain, and we can't get rid of it. And we don't want it to be gone. We want to keep the alarm system. We just don't want it to be giving us false alarms. We don't want it to be
Exactly.
alarming us when we're actually safe. And so, when that chemical burst happens and there's a tiger in front of you and it's like, run or hide or whatever it tells us to do when a tiger comes. I'm not sure what you're supposed to do. So I'm not going to live through that probably. Let's hope it never happens.
Yeah.
I think, it's that we want to have that reaction to that experience. But when it comes to OCD and we don't know it at first, like I think at
Yeah.
first what we respond seems normal, right? Because that's what we're thinking we should do. We have this anxiety and an intrusive thought a lot of times, and then there's a feeling like we need to do something, and that seems just normal because yeah,
Mhm.
if our amygdala is alarming us and there is a tiger, then I'm going to have that reaction. I'm going to have a thought, and then I'm going to have a response. Like I'm going to react to that thing. So that's
Yeah.
normal. But it's when it becomes somewhat predictable around a certain pattern of behavior, right? Like a certain kind of thing. And like we said earlier, it takes up so much time.
Yes, and, the other aspects to someone's reaction to these intrusive thoughts, sometimes they're not always rational.
Mm,
Just because you wear the color red, that doesn't mean you're a devil worshiper.
mhm,
But like there are a lot of young people and sometimes adults, but that religious OCD shows
mhm,
up where they feel like, oh, if I do this, then the devil's going to possess my soul. Or if I do this, then God's going to be angry with me.
mhm,
And it's just a repetitive cycle. It's a repetitive worry.
mhm.
And, and sometimes in some respects, like their concerns can sound reasonable of like, oh, if I don't pray today, then God's going to be angry with me. It's like, okay, we can understand that. But then the OCD crosses the line because then they feel
Mhm.
like they need to pray 20 times a day or they need to
Yeah.
pray in a certain way. And then they're
Mhm.
repeating the prayer. And
Mhm. Yeah, and
so,
I think that's another sign that parents can be looking for in themselves too is like if the ritual, right, the way in which you
yes.
want to do it gets disrupted in some way, that then you kind of have to start over,
Yeah.
right? Like that you can't just whereas like if you're having anxiety or you're not struggling with OCD, you would be like, okay, where did I just end? And then you'd be able to keep going. But there is a part of OCD that generally requires them to start over.
Yes, very good point because I remember a young child who did that whole scenario of starting over because of a broken cookie. Like they had
Mhm.
to have a cookie that was perfectly round and unbroken, or
Mhm.
else it was a tantrum.
Mhm.
You know, now maybe it could have been a sign of autism, but from the OCD lens, that's also a very likely sign
Yeah.
too that they have to start over.
Yeah. So, like, just being conscious of that. And I think it's about collecting these pieces, right, together and talking to providers like your pediatrician or a mental health provider to say, like, hey, is this something, right? Is there something here or is there not something here? And I think parent guy, especially mom guy, is generally on to something where they're like, it just, it just doesn't feel quite right. Right? Like,
Mhm.
this seems
Mhm.
like yeah, there's anxiety, but, like, this just seems more, right? Like, it just is so much more than maybe my other kids or other kids I've seen, or I'm a teacher and I haven't seen it like this, or like, you're comparing
Right.
something that seems expected or within normal child behavior to, like, this just seems more. And I think trust that part and ask
Exactly.
for help.
Yes, and that's exactly right, Bryce, because when things feel like it's more, like it's just too much, it's a little extra,
Mhm.
that's not your typical anxiety.
Yeah.
Because sure, we all worry about getting the flu from time to time, but
Mhm.
we're not checking our temperature 5 times a day,
Mhm.
nor are we asking our mom and dad, are you sure I'm not going to get sick?
Mhm.
Or we're not avoiding people at school because we know that they were just sick.
Mhm.
So, and then I've heard stories too of kids, they will avoid sitting in a seat that someone else has sat in because they were sick before.
Mm.
So sometimes it's connected, sometimes it's not, but
Mhm.
avoidance is another key factor with the cycle because
Yes.
avoidance is also a compulsion because they are not wanting to deal with that uncomfortable feeling
Mhm.
that that comes along with the fear.
Yeah. Okay, so thinking about this, like if we have our kid who doesn't want to do something or us, right? But let's talk about
Okay?
kids specifically. And they're like, I can't go to school because everybody's sick, or I need us to drive this certain route because then that's how I
Yeah.
didn't get sick, or
Mhm.
I have to like wipe down everything before I touch it, or I can't go to the bathroom in public places even though I have to go to the bathroom really bad. Like, how
Mhm.
do we stop from accommodating the OCD? right? As parents, this is such a hard part of
It
we're worried
is.
about reinforcing the OCD or letting our kids down, right? Like we don't want our kids to be anxious. And so we worry that we're like not being a good parent. So what can we
Mhm.
do?
Yeah. Well, and the mom guilt is real, like,
Mhm.
we want to take care of our kids, and we don't want to fail them in any way, and, like, your job as a parent is to help, like, make your kids happy, but, in the sense of, like, they're well-rounded adults and responsible and all the things, but it's really hard to see your kid struggle.
Mhm.
So, as the parent, I mean, I encourage you to get your kid into therapy,
Mhm.
especially with an OCD therapist, because then you can also learn some of these tips and tricks to get support for you. But then you and your child are on the same page,
Yes.
and your child can see the importance behind what you're doing because it's going to
Mhm.
be new, because you're no longer going to be giving reassurance like you once were.
Mhm.
So, there's a couple of things that parents can do. First of all, when it comes to responding to your child, you're going to be more like their coach. And you're going to be coaching them in the way of giving them validation, like validating, like, honey, I know it's hard. I know it feels scary to go to a public bathroom, or I know it feels scary to have this pit in your stomach that you feel whenever you do these things. But I want you to remember that you can do it.
Mhm.
So you follow it up with a statement of confidence.
Mhm.
Now, another thing that can help with the reassurance seeking is I encourage parents to get a notebook, put it in a central location, normally their dining table, write down all of those questions that they get asked multiple times, write down the answers in there, and then whenever their child asks that question, tell them go check the notebook, because nothing
Mm.
nothing has changed.
Yes.
Most of the time they don't check the notebook, and so there we've interrupted the cycle.
Yeah. And so the goal of therapy is to interrupt the cycle,
Yes.
right?
Yes,
To disrupt that process of like, I have this thought, I have to do this thing.
exactly. And kind of going back to one of your earlier questions, whenever you interrupt the thought, the cycle becomes less frequent and less intense.
Mhm.
So, whenever we're doing the exposures, kids especially catch a lot of traction very quickly, a lot quicker
Mhm.
than adults. But I think it's because just of the neural pathways. They haven't been there as long, they haven't been reinforced as long. So,
Mhm.
what happens with the exposures, like at first, the anxiety, like on a scale of 1 to 10, it might go up to an 8. And then after 5 minutes, it'll be back down to a 2 or 3. But then the second round of exposures, it might only go up to a 6. And
Mhm.
then within 2 to 3 minutes again, it's back down. So these exposures can be very quick until eventually the child is in a place where, like, they're not even bothered by this fear anymore. Like, they
Mhm.
see the trigger, and in 10 seconds, or as soon as I ask the question, I'm like, "Where are you in 1 to 10?" They're like, "I'm like a 2," you
Mhm.
know? So it's really cool, but in any case, um, the parents have to also buy into the treatment because, sometimes the exposure work is just very different from your traditional talk therapy.
Yeah.
So me asking you to eat a snack off the floor, the parents are like, "Oh my gosh, are you serious?"
Mhm.
But yeah, the, thoughts and the intensity and the fear, everything gets quieter and less
Mhm.
frequent with the
Yeah.
exposure work.
Yes. Yeah, and we're, like, cleaning the floor before we're not, like, gonna have them eat off a dirty floor necessarily.
No, no,
We're
and,
not trying to make your kids sick. Yes.
yeah, so and that's where it has to be reasonable because, like, I've
Mhm.
seen, like, some stuff out there on the internet or TikTok, and I think it's probably just, entertainment or bogus stuff, like, people acting like they're gonna eat off a toilet, like, I will never ask you to do that
Mhm.
because that's not part of your day-to-day life, like, that's the
Mhm.
other thing with exposures, it needs to be part of your day-to-day life. Now,
Yeah.
will your food come in contact with germs? Yeah, it will, but
Mhm.
we're not gonna do anything unreasonable to, like, risk your health.
Yes. Yeah. Yeah. Well, and it's hard. And it's hard to see your kid struggling. And it's hard on
Mhm.
both sides, right? But I think the important thing to remember as parents is by doing this type of therapy and being able to manage the OCD, what we're doing is, yes, it's hard, but there is hope and peace and
Yeah,
less discomfort on the other side of that versus staying in this place where we know that they're uncomfortable. We know that they're struggling, and we're generally
exactly.
struggling too.
Exactly. Yeah, because it gets exhausting for parents to
Mhm.
answer all these questions or try to save their kids from these fears because and OCD loves to ask questions that are nearly unanswerable.
Mhm.
I mean, that's how it wins,
Yeah.
because you'll never find an answer no matter what you do, but somehow
Mhm.
internally you feel convinced that eventually you'll get the golden ticket, like, you'll finally get that winning answer, and
Mhm.
no, you won't. Like, that's
Yeah,
just
it's
the
just barely out of reach. Yeah, that there isn't like
yeah,
no one could really assure you that you're not gonna say something today that's gonna get you into trouble or that you aren't gonna get sick because it's like we can't tell the future, right? And
exactly.
so we say like, "No, that won't happen." But then our kids are like or other adults are like, "But maybe."
Mhm, mhm.
Maybe they're wrong. Maybe, right? This maybe game that OCD definitely plays with us.
Yes, and so if you can get to a place where you can accept maybe or maybe not,
Mhm.
that can help you in tolerating the discomfort.
Yeah, this is hard. Okay,
Mhm.
so what do you think are the first steps? So, like, let's say through this, you're like, okay, yes, I think I or my kid has OCD. What do we do next?
Yeah, I mean, I really, really recommend the therapy just because it is so effective, and so finding someone who does have a history and experience of treating OCD. I mean, really from there, I think once you're in therapy, you're in good hands.
Mhm.
Yeah, here's the other big piece that I think people can start right away is stop researching on Google.
Yes. Yeah.
Because so many times, especially kids these days, they are researching on Google about all the symptoms of stomach bug or am I a bad person because I thought this? And it's like,
Mhm.
just don't go to the internet
Mhm.
because the researching online, it's another form of compulsion.
Mhm.
So just do your best to, and here's the big picture when it comes to the compulsions. You delay, skip, and decrease. So if you know you have rituals around hand washing, see if you can delay it. See if you can
Mhm.
wait 5 minutes. Or maybe you're like, okay, I know I wash my hands like after recess. Let me just skip it time. Now I'll still wash my hands before I eat lunch. That's fine, because that's reasonable. But then maybe
Mhm.
when you go to wash your hands before lunch, don't wash it so like the 20 times that you do. Try to decrease it down to 10.
Mhm.
Maybe it's 10 rubs, or 1 pump of soap. So, overall, it's a delay, skip, and decrease with the
Mhm.
compulsions.
Yeah. Well, and sometimes there's kids who don't want to go to therapy. They're like, I don't want to do this. This is too scary. Are you familiar with the SPACE program that navigates OCD and anxiety?
Yes, I have heard of them, and I've, listened to several of their trainings before. Yeah, I'm familiar.
Yeah. And so I think that Dr. Levowitz, he came up with a great program with his team at Yale to help parents help their kids to manage these symptoms because sometimes a lot of it is parent responsibility, which kind of stinks, right? The kid also has to do the
Yeah.
thing, but like we have to, as parents, understand why we're doing it and what we can
Mhm.
do to help our kids to tolerate the discomfort of managing both anxiety and OCD. So if you haven't heard of his program too, that's great. And he has a book
Yeah.
out, and we'll link it in the show notes. And he's actually been on our podcast before to talk about his program. So check that out too.
Awesome.
So yeah, I mean, there's a lot of different ways, but I think, using something that is well researched is the key here, right? Like we want
Yes.
to make sure that we're putting our kids or ourselves into a program where we have lots of data behind to support the process.
Mhm. Mhm.
Yeah.
Absolutely.
Well, thank you so much, Erin. This has been so helpful to understanding OCD and kind of the tricks that it plays
Yes.
on us and what we can do to help manage it.
Well, thank you so much, Bryce, for having me today. And if uh, people want to connect with me, I've got a podcast show called Bossing Up Overcoming OCD. They can also find me on Instagram, YouTube, Facebook. And I've also got a handout, a checklist called the 10 Signs of Relationship OCD checklist, which I can pass along that link
That would be
for you as
amazing.
well.
Yes,
Hmm.
wonderful. I love resources. So thanks
Yeah,
again, Erin.
I appreciate it. Thank you.
Thanks again, Erin. That was all really helpful information. I hope that you've taken away something helpful from this interview and you've learned something more about childhood and adult OCD. With that, I will say thank you so much for your time today. Please like and subscribe to our show. Please rate us. Follow us on Facebook, Instagram, YouTube, and TikTok. And also keep the emails coming with future topic suggestions to accidentalexperts@gmail.com. Have a fantastic day. Some words from our legal team.
The information presented in this podcast is not intended or implied to be a substitute for appropriate professional advice, diagnosis, or treatment. All content, including text, graphics, images, and information contained on or available through this podcast, is for general information purposes only. This podcast makes no representations and assumes no responsibility for the accuracy or information on or available through this podcast, and such information is subject to change without notice. You are encouraged to confirm any information obtained through this program with other sources and review all information regarding any condition or treatment with the appropriate professionals.
What we're saying is, yes, I am a real therapist, but I'm not your therapist.